Hey everyone, I hope you can hear this. I'm having to whisper. I'm in my hospital room. I had my hysterectomy today. It's quite late at night here and I was having some trouble sleeping anyway. Just because I can't lay on my side. It's very painful to lay on my side. But I thought I would, I guess, kind of get you guys caught up on what's going on with me. So yeah, had my hysterectomy today. My mom brought me to the hospital this morning, and actually they got me back there for prep pretty quickly, but we had to wait a little extra time, longer than expected, for the surgeon to stop by and to let me know that it was going to be my turn next, because the patient before me that she was working on, they found something unexpected apparently, and they had to run into some overtime to complete that patient's operation, which is only fair. So yeah, once they wheeled me away for surgery and got me back in the operating room today, I mean, it went pretty quickly. I mean, I got back into the room and they were helping me get situated on a rather odd sort of bed. I think it's the kind of hospital bed where it was really narrow. It was kind of like being strapped to like a surfboard almost, and I'm pretty sure what they did was they had to, it's mechanized and it could like tilt your body so that they could get the laparoscopic tools in the correct position to work on you. But the last thing that I remember was a woman sitting in a chair next to me, and she was asking me if I was comfortable, and she said, "Oh, can you scoot over to one side about 2 more inches for me?" And I'm like, "Yeah, sure." And she goes, "Okay, I'm going to give you your medicine now." And I said, "Oh, well, which medicine?" Because, I mean, I had been told like a billion things that I was going to be given, like yesterday and today, but she goes, "The kind that's going to put you to sleep for a while." And that was like the very last thing I remember. I mean, like the minute she put it into my IV port, see, I've got an IV port. The minute she injected it into my port on my IV, like, I mean, I was gone. And then what felt like only a few minutes went by, and I was waking up in the recovery area, and there was a man there talking to me and getting me covered up with blankets and kind of taking my vital signs and just sort of talking to me and checking me out. And so, but I was surprised it's actually very nice and quiet at the hospital this late. And the nurse explained to me that anytime a patient pushes the call button these days, it goes to a small, like, kind of a phone-like device in the nurse's pocket, instead of being blurted out really loud over a loudspeaker in the hallway, so that patients can sleep and aren't being disturbed and whatnot. And they're taking pretty good care of me here. They've been giving me Lortabs, which help me relax a great deal, and they take care of the pain. However, I just can't sleep in here. I can't get nice and dark like I want it, and I can't lay on my side, and so I'm basically kind of stuck on my back. And I'm sure you can probably hear my little machines and stuff they have strapped to me. So it's a pretty nice room in here too. It's nice and clean. It's tastefully decorated. It's practical. So yeah. And apparently when you're having laparoscopic surgery, there's a risk of getting like blood clots afterwards. So like during the surgery and ever since, I've had these things like wrapped all around my legs, and well, here, I'll just show you. And I gotta continue to talk quietly because I don't want them to come in here and say, "Oh, you can't have that camera." But anyhow, so I'm just gonna show you these things on my legs. There's the little machine right there. I don't know if you can see that little machine. And it's got these tubes coming out of it that are going to these things wrapped around my legs. And it puffs up, kind of like the thing that they use to take your blood pressure. And it also vibrates. And I think the idea is it is supposed to kind of, like the massaging that it does, is supposed to help kind of stimulate and engage the muscles in your legs, and so that your veins don't get clogged or whatnot. That's what a blood clot is technically, is when your blood clots inside of a vein when it's not supposed to, and it causes a blockage. And actually a blood clot in the leg can be fatal. I think it doesn't really matter how old you are. So, and this is the other thing that keeps me awake at night, by the way. So, yeah, but here's my room. Just, there's one of my monitors down there on that little table. You see, like, my heart rate and everything, and my oxygen level. Heart rate's a little bit elevated right now just because I'm moving around more than I have in the last few hours. So, yeah, I have a little table. I brought my phone, and I've got a book I'm reading. If I could pick it up. So, yeah, there's my book, and my backpack of stuff, and the bathroom door. And there's actually a really nice spot over there where family members who choose to stay the night with their patient in the hospital, they can stay the night over there. So, and I even brought my white noise machine. You can see it back behind there, because I can't sleep without it, and it's really soothed me a great deal. I think I'd be twice as miserable and groggy if I didn't have the noise machine, so yeah. So yeah, I can't get up to go to the bathroom by myself. Someone has to come with me because, first of all, somebody has to like unhook all this stuff I'm attached to so I can get up. And my IV fluid, that has to go with me. They just wheel the pole thing in there with me. And peeing, sitting down, sitting up and standing up and sitting down is actually what hurts. And my mouth is really dry, so if I sound kind of funny, I do apologize, but I really can't do anything about it. It's just the anesthesia. So, but yeah, I can't go to the bathroom by myself. And my pee is coming out orange because of some medicine they gave me before the surgery to help prevent painful urination after they insert and remove a catheter during surgery. And so it's kind of funny, but yeah. But actually the side effects of the anesthesia aren't bothering me nearly as much as people had led me to believe. Like, I was nauseous for only like an hour after, like once they got me up to my room, and I started feeling a whole lot better. And I did eat. I had some crackers and some chicken broth, and that helped tremendously. And I had some Jello, and like, since I couldn't eat anything after midnight last night, I was starving. And like, the nurse was like, well, we can give you some Jello. And like, I never ever once in my life thought that I would be so excited about freaking Jello. But I was, and I ate it, and I'm like much happier. It actually did a lot for me. But the reason I'm having to eat like soft food is because I don't want to get hard stools or hard bowels. Because first of all, if you've had abdominal surgery, having to deal with a hard bowel moving through you is very painful, and then having to pass it, having to like bear down to pass the bowel movement is painful as well. So the softer the better, really, is kind of how it goes. So far I haven't had any like adverse reactions to anything. I'm not miserable or anything. I mean, I do feel pain where my incisions are, and it does hurt like inside where they removed my uterus and had to suture where my cervix used to be. I mean, they don't leave a gaping hole, obviously. So, but and also the surgeon, the doctor, she did tell my mom and dad when she saw them, like right after surgery was complete. I was still asleep, of course, but she tracked them down in the waiting area and let them know that everything had gone okay. I didn't have any endometriosis. I didn't have any scar adhesions, which really surprised me, because I honestly thought that was what was causing so much of my pain. Apparently it was just a uterus that doesn't know how to behave itself. But everything went smoothly. They didn't run into any kind of problems, and it went quickly, and so yeah, I'm doing alright, and I'm supposed to go home at some point in the morning, and I think I will be allowed to eat slightly different food, and I'm still going to stick to soft food though. So, okay, I think I should be done talking, because I think someone's coming down the hall, and on the off chance they come in here, I don't want to get in trouble for having a camera. So, I'll see you later. Hey, I'm back. I hope you can hear me. I'm whispering because, once again, I don't want them to like hear me talking to myself, and I think either I need to be committed or catch me with my camera or something like that. But And I decided to come do this in the bathroom. It's really busy out there, there are a lot of people walking around, so anyway, I'm being discharged and I already signed my discharge papers and I actually feel really good today. I just have like a little bit of pain down in my belly where my incisions are, and so far so good. I mean, I'm not feeling sick or nauseous at all. Like the CO2 gas hasn't worked its way up and started bothering me really yet, and I'm actually feeling pretty good, and they prescribed me some medicine for when I do get some pain when I go home, but I'm supposed to be in here brushing my teeth, and then I'm going to get dressed, and then hopefully my mom and dad will be popping in and to pick me up, and I'll be able to go home. So I guess I'll see you guys later. Bye.